from a clinical trial standpoint, which is the topic du jour, there are other companies who do other pieces of what 83Bar does. They don't do it in an integrated way, the way in which we do. And I think that the benefits to the three different types of trials that we talked about, virtual, hybrid, and insight or site-based models, really benefit from an 83Bar type of approach. Because it's not just about can you find the patient, that's certainly important. It's not just can you get them to fill out an online survey that is written in patient-friendly language in a really simple to answer format and that aligns really well with your protocol. And it's not just about the ability to rapidly connect them to a contact center staffed by nurses. And quite honestly, the piece I think often gets mishired based on empathy score. So when you're dealing with diseases where patients are waxing and waning, they're agitated, they're frustrated, they're friction points, having someone who can really meet that patient where they are emotionally and mentally is super helpful. But I don't think that's even just enough, although it's amazing what we do. I think then the variations on a theme of how you connect a patient in so you don't allow for too many exit ramps for that patient. You don't lose them in their process. And then on the back end, working closely with the clinical trial sites to make sure that they have what they need to be able to close the loop with that patient. And then tying it all up from a reporting standpoint so that each step in that patient journey is visible and we have opportunities to optimize at each step in the way and really ensure that those exit ramps are minimized, the friction points are minimized, and the data is really rich for our sponsors so that they've got the best opportunity to optimize their clinical trial from first click on an ad set all the way through to randomization and beyond. I think that's super important. And that visibility that we give at every step of the way that our technology enables, coupled with that ability to personalize at scale, really sets us apart in the level and the quality of support that these clients are getting. And in today's world order, having that extra personalized journey for the patient, minimizing the number of buttons they have to click and the interactions that they have to have, just makes it a much more enjoyable experience, I think, for everybody who's involved. So I think from a differentiation standpoint, especially as you go virtual, especially when you have less connectivity on a day-to-day basis with other folks, you know, having that personalized experience, the ability to find me where I am, and then on the back end, making sure you've got the data to meet the needs of the trial.